Dr. Swapna Athavale. She is plastic and aesthetic surgeon from Pune. Hello, Dr. Swapna.
Hi Akshata.
Today I actually wanted to discuss a very taboo kind of topic, which is breast reconstruction, but there is like so many misconceptions around it. So I really want to ask you, what exactly is breast reconstruction?
Breast reconstruction, we require a lot of awareness in India because ladies are not aware of this new concept of breast reconstruction. Breast reconstruction is a surgery which has been done for breast cancer patients. Whenever cancer surgeon is going to remove somebody's breast, we need to reconstruct the breast by using either autologous tissue or some kind of implants. So we need to understand what is the requirement and what is the socio-economic factors which are affecting this kind of reconstruction in India. So today we are going to discuss a lot of techniques which are involved for this breast reconstruction. So this breast reconstruction is mainly done for breast cancer patients. When cancer doctor is going to remove either the part of breast or the whole breast, losing a breast tissue is sometimes a psychological trauma for a woman.
Yes.
And nowadays there are so many advanced treatments available for cancer, so the survival rate for breast cancer patients is really good, and that's why we need to consider breast reconstruction as an upfront option, which should be discussed with each and every patient who is opting for either partial or total reconstruction, that is called as mastectomy.
Okay, and which kind of patient do you think should opt for these procedures?
So there are two sets of procedures which we can offer. Either the patient who has been recently diagnosed as a breast cancer and patient is opting for partial or total breast removal, that is mastectomy. We should discuss the options of primary breast reconstruction. Primary breast reconstruction is the reconstruction by using, most of the time it is autologous tissue, or sometimes it is implant, and sometimes it is combination of autologous with implant. And this primary reconstruction is whenever we are removing some organ, we have to reconstruct that organ. It's just like removal of your mandibular part. When patient is having oral malignancy, we need to reconstruct that part for getting the facial occlusion. Similarly, whenever we are removing the part of breast, we need to reconstruct the part of breast at the same operation. That is called as primary reconstruction. Another set of patient is the patients who have already undergone breast surgery, that is MRM, a total removal of breast, and they have completed their chemotherapy and radiation therapy. Then those patients can opt for secondary breast reconstruction after a year of completion of their cancer treatment. These are patients who are secondary breast reconstruction.
Okay, and what are the procedures for doing this process, you know?
As we have discussed, there are two sets of procedures which are available. Either reconstruction of breast by using your own abdominal tissue, this is called as tram flap or sometimes DI flap. So the abdominal tissue we have to reconnect to make a chest mount, and breast reconstruction can be done by using your abdominal tissue, that is autologous breast reconstruction. Sometimes we use back tissue, that is called as LD flap reconstruction, or sometimes we use breast implants to reconstruct a breast mount, that is called as implant based reconstruction.
Okay, and as you have mentioned, Dr. Swapna, that it is for a cancer, breast cancer patient, and always a breast cancer patient would like to opt for this kind of surgery. Does it affect their cancer treatment by any chance?
This is a very good awareness question. Breast cancer treatment never gets affected because of reconstruction, as most of the patients opt for primary reconstruction. So the healing time for breast wound is same as the tissue wherever we are taking it, either from abdomen or either from back. The recovery time of this patient is 2 to 3 weeks from the day of surgery, and patient can start chemotherapy or radiation 3 to 4 weeks after surgery. So breast reconstruction will not affect your cancer treatment at all.
So even if when a person is on chemotherapy, he can have she can have a breast reconstruction.
Sure. So this is called as sandwich treatment, where sometimes patient in India do present with advanced breast malignancy. So that time what we advise patients to go for first finish your chemotherapy cycles and then come for breast surgery. and the breast MRM or breast removal surgery will be done with breast reconstruction surgery, and after finishing both the surgeries together, patient can opt for radiation post-operative after 1 month.
Okay, that's really nice to know, because we all understand that, you know, losing a breast all of a sudden, how traumatizing can it be for a
True.
female. And after this many question and answer between us, I really hope that we you know, spread an awareness about breast reconstruction, and it is actually a safe procedure.
Very
you
safe,
know,
very
very safe procedure, and I think it is getting common and common among the people who are diagnosed with this.
So for
particular-
getting it more common, we need to give option of reconstruction of breast, which is always available, as most of us plastic surgeons are aware of doing, and we are frequently doing breast reconstruction. So during your conversation about, you know, oncosurgical part and general surgeon or oncosurgeon who is going to remove your breast, you need to always ask your oncosurgeon about reconstruction, so that it will be a combined decision, and we work as a team where oncosurgeon, plastic surgeon, radiation oncologist and chemotherapist, we work together as a team, and we take most of the decision are our team decision. So plastic surgeon is a vital part of breast reconstruction team and breast cancer treatment. Thank you.
Okay, that's really nice of you, Dr. Swapna, just to raise such a nice awareness about this topic and clear so many questions that I had in my brain. I am really glad I had a talk on this particular issue with you and this particular topic with you. Really, thank you.
Thank you, Akshata.